So I wanted to have a little impromptu conversation with Dr. Marema.
Hello.
We don't see him very much because, well, he is a busy guy. He's a surgeon. He operates all day and he is in coaching and on our webinars. But aside from that, he's not a Facebook guy. So I thought it might be cool just to get him in the room. We're about to do a masterclass tonight. So I had him for a few minutes and just chat. So I'm just going to ask him a question, and he has no idea what I'm going to ask. And it's something that y'all talk about in the group or something that I feel is really relevant to you. And we'll just do these every once in a while from time to time, and we'll just get some input from Dr. Marema, because who better of an expert to ask questions to, right? I mean, don't you all want to have just like an expert bariatric surgeon who's also a patient, who's been through his own struggles to just bounce things off of? So I'm going to fire a question and you're going to come up with a brilliant answer.
Okay.
Are you ready?
I'm ready.
So something that comes up a lot is text messages while I'm trying to have a conversation with you. I'm going to turn the phone off now. Something that comes up a lot is people saying, I've gained weight. I need a reset. What do you have to say to somebody, whether it's in the office or a client online that we work with, when they say, what kind of reset can I do?
Well, actually, they usually come in suggesting that they need a surgical reset. And it's one of the most common misconceptions is that the only way to get restriction back, or that sense of early fullness or food satisfaction, is to go ahead and have another surgery. And for some reason, this is promoted online, but it's true. It's definitely false.
Okay, can I stop you right there though? I want to say why it's promoted a lot is because surgeons are technicians, and surgeons have a tool to use, and that's their hands and the instruments. So of course, surgeons would promote, I can do revision. Now you also do a ton of revisions. Who is your primary candidate for a revision?
Well, so sometimes patients truly do need a surgical pouch reset because they may have either a very large pouch to start with, or they may have an associated hiatal hernia that's causing them difficulties. Or in the case of a sleeve, they may have some restriction by twisting or angulation of the sleeve that causes the upper part of the stomach to kind of expand. And so these are some of the structural reasons why we might look at a surgery in the situation where the patient asks for a reset. However, the majority of patients, particularly the more than 17,000 that I've operated on, when they come in and we do an upper GI, that's not an endoscopy, but that's an X-ray to get a sense for the size and the shape of either their sleeve or their bypass. That allows us to see if they have one of these structural problems. The majority don't. Not just the majority. 90+% do not have a structural need for intervention, but they do still feel like they need a pouch reset. And in that case, then we embark on some of our usual things that we use in TBSM to make lifestyle adjustments that result in the sensation of a pouch reset.
Right. So then what you're saying is that there are modifications that people can make in what they're doing in terms of the foods they're choosing, the sequencing that they're choosing,
the eating and drinking at the same time,
right,
dramatically increases food tolerance.
So it goes back to what we teach in the bariatric success method, which is balancing the blood sugar, choosing the foods that work for your body to release fat, because you're not feeding your body things that, starches and sugars and things like that. maybe implementing some more advanced strategies, intermittent fasting or something like that, and just really buttoning up the things that they're doing.
Correct.
I mean, I know that we have plenty of clients that we have worked with in our 4-month coaching program that came in and they were like, they felt like they had no hope, right? And they were like, I have got to try this because it's really I have to try something. And within weeks of working with us, multiple people have remarked and have been super ecstatic that they felt like they had their tool back. They felt like, I have the feelings that I did early after surgery, and I thought that was gone forever. And I think that's really cool. And they didn't need a surgery to do it. But
And by the way, it's a lot faster to do it that way than it is to have a surgery. What I have seen in the past, and it's interesting that we kind of got into this topic, but what I have seen is, and unfortunately I'm responsible for doing some of them myself, is patients who have a surgical pouch reduction for the intent of a pouch reset. They don't really feel it after, maybe a month or so, maybe 6 weeks.
well, wait,
They're back to the way they were, because it's not really about the size of the pouch.
yeah,
It's about what they're doing with it.
yeah. I mean, like one really easy example is eating slider foods. When you Google bariatric surgery and slider foods, I mean, if you're going to choose to eat popcorn or pretzels or chips or things that melt in your mouth, then you're not going to be restricted. That's defeating the purpose of the operation. It was never going to restrict that. I mean, I like to tell people, you have to envision your stomach as kind of like funnel-like, especially in a bypass, where, you've got this like wider part at the top and this narrow part at the bottom.
In a sleeve as well. And let me just explain that for a moment. There's a point in the stomach, anatomically, it's called the incisura, but it's about halfway down the stomach. And it's sort of a natural place where the stomach kind of takes an angle.
Okay.
And that's the tight area in a sleeve.
Right.
So it's not the lower part of the stomach where the stomach actually empties into the small intestine on a sleeve. It's the middle.
Well, that makes sense because I have a sleeve myself, and I know that there's certain foods I could eat all day and not get full. But if I eat the right type of food, I'm going to get full quickly. Right. And that is what we want, right? I mean, consciously, that's what we want. Subconsciously, I'm not so sure, because we still are fighting the unconscious pre-programmed behaviors of eating lots of volume for comfort or for a certain satisfaction. And so our way around that, after we have a restrictive operation, is just to eat foods that are going to allow us to eat more of them. I mean, it's sort of like, whether we admit it or not, that's what we're doing. That's what we're doing when we're grazing constantly, or we're picking foods like, nuts and chips and, just easy to eat foods. So, well, that's really interesting. So, really when you're talking about doing a pouch reset, it's really resetting your gut hormones. It's really resetting your behavior and your habits that leads to a result that is maybe even superior, would you say, to if you went somewhere and had somebody trim the size of your pouch?
Oh, it's absolutely superior, because it puts you in control. When you're not in control, you can defeat any surgical construction. The issue really is being in control of the tool you were provided, whichever tool that is. Mm-hmm. So, I mean, you take any construction worker, hand him a tool that he doesn't use properly, he's dangerous. So is a bariatric patient not using their tool properly.
All right, guys. Well, you heard it. Pouch resets, surgical interventions, unless there's an anatomical structural problem with your procedure, is very unlikely to get you much in terms of advanced weight loss results. I mean, we've been around in the bariatric business for a long, long time. And every time a new thing comes up, I remember 15 years ago when people were putting bands on top of bypasses. And you said, because you're always on cutting edge. So you're always looking at the data and you're like, maybe I should try it, right? Maybe I should offer that. But you looked at the data and you're like, this is crap results. Why would we put somebody through this to get, a 15-pound weight loss? Like, that's not good. So, I think a lot of things, if we've seen a lot of things come and go over the years, and everything from, plications and, endoscopic this and that, putting bands on top of bypasses, all kinds of different solutions. Somebody posted in the group recently about, they heard about Botox in the stomach. It's just an attempt at another kind of quick fix, when in reality, the solution lies within us. And the sooner we recognize that and face it, even though it sounds uncomfortable and we'd rather have somebody else fix it for us. But the answer lies within us. And we just need to get the information and the support around how to use our tool to the best of our ability, so that we can fully take advantage of it. Because until we do that, we're going to always be looking for the next thing, and we're going to waste a lot of time.
Amen.
All right. Thanks, guys.